The 6 rights are one of the most key fundamental concepts to practice whenever you're assisting a resident with medications. You should ensure that you're following all 6 rights every time you help a resident to take a medication. The 6 rights include the right resident, right medication, right time, right route, right dose, and right documentation. We begin with the right resident. We always want to make sure we're giving the medication to the correct person. You can verify this by checking the photo that is kept with your medication records or in your electronic MAR. Don't ever just trust a resident by asking their name, especially if you're new to the community. Always verify with your photo. Make sure you're giving the right medication. This is usually pretty clear, but it can sometimes get confusing when we have generic or brand names of medications. For example, the physician may have prescribed Lasix, but your pharmacy may have provided the generic furosemide. The label should always have both names to help clarify, and you can confirm with the pharmacist if you're ever unsure. This is also a good time to remember the 3 checks. You should check the information on the medication against your medication record 3 times. Check it when you pull the medication out. Check it again when you pour the medication. And check it one last time before you return the medication to storage. It is important that medications are given according to a consistent schedule. It is not common that a medication is prescribed to be taken at an exact time of day. Therefore, we usually can follow what's known as the 1-hour window. So if we've decided to give a medication at 9 a.m., we could give it 1 hour before or up to 1 hour after. Confirm with your supervisor and state regulations that the 1-hour window is acceptable. Of course, we want to assist with the medication via the right route. The route of medication delivery is usually pretty straightforward, but watch out for things like sublingual medications that should be held under the tongue rather than swallowed, or ensuring that the drop is meant for the eye, the ear, or the nose. Make sure the resident is taking the right dose. The dose should be clearly indicated on the medication label and in your medication records. However, you should have some familiarity with calculating the dose on your own to ensure that errors are avoided. The basic formula to remember is to divide the desired dose by the strength of the medication you have on hand. For example, if the doctor had ordered 500 milligrams and you have 250 milligram tablets, you would give 2 tablets to ensure the correct dose. Finally, the last step is right documentation. We always want to document our medication assistance accurately and timely. Following the 6 rights and verifying via the 3 checks every time you assist a resident to take a medication will help to avoid dangerous medication errors.